Hey, City Councilor Pop Barnes here with Focus on Health. Focus on Health. And guess what? We're going to give you Susan Gallagher, who you can't see right now. She's to my right. We're going to give you some really good information that pertains to NOW. Now, that's a teaser, and I'll see you in about 10 seconds. Welcome back to Focus on Health. Well, what was the NOW? The NOW is now. This pandemic has created and touched everybody's lives through the entire world. And so a lot of people are going through things and feeling things that they don't really know what's causing it, or should they be feeling it? And they're overreacting, underreacting, everything. Well, to my right, I have a very good friend of mine, Ms. Susan Gallagher from New Horizons Behavioral Health, is going to tell you, and I'm not going to steal her line. She gave me a line on my Facebook Live show that you can't beat. So Susan, you look in this camera, I know you remember, and tell everybody something about you, and then I want you to give them your tagline before we even start the slideshow. Right
Hi,
there.
Susan Gallagher, Director of Development, Marketing, and Community Relations with New Horizons Behavioral Health. And I believe the tagline you're talking about is, "It's okay to not be okay."
That's the line. That's the line. And the reason I want her, because a lot of people are going through things and they're feeling certain ways, but they don't know why they feel that way. And that adds more to their anxiety, more to their depression. And so when Susan mentioned on the Facebook Live show, you know, it's okay not to feel okay. And people need to know. I said, Susan, you know, we need to do a show like this one here on Focus on Health, that people will know what they're feeling and why they're feeling, and that it's okay to feel that way.
Right.
And so ergo, that's why Susan is right here in the studio. And Susan, I looked at the slides when we did a Facebook Live show, so much good information. So I know we need to get started so that we'll be able to finish an hour at a time. So I'm going to turn things over to you. It is, according to the computer, a public health crisis. And what you need to say is to let Bruce know when you want to go to the next slide so he can change them.
Well, you can see the character sitting at the desk in this slide, and behind her is a tidal wave looming, ready to engulf this individual. And that is the mental health crisis that we're affecting right now.
It's like a tsunami getting ready to hit.
Right, the tsunami getting ready to engulf us all.
Right.
Next slide, please. So the average life expectancy in the U.S. has been on the decline for 3 consecutive years. And this is attributed to a rise in drug overdoses, an increase in liver disease, and a rise in suicide rates. In the mental health community, we call these diseases of despair.
Oh my, and you want to know something? That's alarming to know that if for 3 consecutive years, it's been declining.
Right. Right. Our average life expectancy has been declining in the United States.
Oh my gosh, and with all this technology, so you know it doesn't always have to be physiological, the reason. Probably due to a behavior or emotions and all.
Exactly. The last 3 years represent the longest decline in the American lifespan from birth since the period between 1915 and 1918, which included World War I, the Spanish flu pandemic, events that killed many millions worldwide. And I wanted to talk a little bit about these diseases of despair. Rise in suicide rates. Suicide is already the number 10 leading cause of death for adults in the United States. And mental health professionals anticipate there's going to be a rise in suicide deaths due to the COVID pandemic.
Oh my gosh, because people don't know why they're feeling, and they feel depressed.
Exactly. That tidal wave of emotions that's getting ready to engulf us. Next slide, please. The COVID pandemic is emotionally, financially, and socially devastating for the country. And I think I heard on the news last night that we are approaching 250,000 250,000 individuals in the United States that have died from the COVID virus.
Are you serious? Of a quarter of a million people?
A quarter of a million. That's what they were saying last night on the news, yes.
That's alarming.
Yes, that's very alarming. And although the coronavirus has directly affected the physical health of some individuals, we have all suffered the emotional impact and trauma caused by the shutdown of schools, businesses, being asked to socially isolate, socially distance, wearing masks, et cetera.
And you know, in New York, they've closed the schools
They're closed,
recently.
the schools are down again. They have a threshold. Once 3% of the population that is testing positive, that's their threshold for shutting things off automatically, right? Although the exact number is currently unknown.
Want to go to the next slide?
Yes, please, next slide. Thank you. Although the exact number is currently unknown, many more people are suffering from anxiety and depression as a result of fear, social distancing, isolation, and the widespread uncertainty due to the COVID pandemic. Next slide, please. And as the economic uncertainty continues, many more people will experience symptoms of mental illness and will need our help.
Right.
As the stimulus check, unemployment payments end, many businesses are not rebounding, plunging some citizens into desperate economic situations.
And I'm going to tell you something, Susan, because what I'm hearing in the community is that the people are not getting feedback because of the lag, because of the pandemic. They're not getting any. It's bad when you don't have the money, and then you don't know when the money's coming in. And see, if you even knew that, but unfortunately, a lot of people are not being able to be told. They're not getting a reply back from the unemployment office.
Exactly.
And here's the biggest thing. When you're not hearing anything, that's a worry.
Right.
You're under the duress of the pandemic, social distancing, not being able to go out. And then you're thinking about eviction, and here's the biggest thing. Where's the money to buy food?
Right, exactly.
And so all this at one time is hitting all of us. And so the thing we need to, first of all, identify with the fact of what you're saying, hanging over all of them, the things that they know. What's really killing them is the things that they don't know, which is the depression, the anxiety, the stress.
Right.
And I think, and you're going to get to the slide, when you mentioned a certain amount of stress and all is really necessary.
It's a normal human emotion. Anxiety is a normal response to stress. Depression is a normal response to life struggles or loss.
Right.
So we are human, and we're not going to be 100% well 100% of the time.
And, But what you just got, say that again, please, because a lot of people need to know that, because their expectation is that they're supposed to be when that's not reality.
No, again, I'll say it again. It's okay to not be okay.
Right.
It's not okay to stay that way. Next slide, please. Some individuals during this time of stress, anxiety, uncertainty may turn to alcohol and other substances as unhealthy coping mechanisms.
Right.
And some individuals who are in recovery, maybe even long-term recovery, 10, 15, 20 years, may find themselves relapsing, putting themselves at higher risk for overdose.
Higher risk for overdose.
Yes, exactly. Next slide, please. So now more than ever, we need to understand that mental health is part of our overall health and well-being. There is no health without mental health. And we need to integrate mental health with our physical health and possible substance use disorders.
Now, I'd like to just linger on this slide for a minute, because this is very important, because in the average, I thought the same thing until I went to nursing school. I thought really only about physical health, not knowing how much the emotional element is there, and give me that expression that the Chief Executive Officer of New Horizon and Andrea Winston calls. She calls it the what? The
sweet spot, that point where mental health and physical health totally align.
Yeah, they interact with each other. And so just to belabor this a little bit, when you're thinking, and I'm talking to our listeners here, so when you're thinking about health, you have to think more than just physical health, because your emotion plays a part. Now, Susan mentioned the fact of stress and anxiety, but if somebody goes boo to you, you're going to jump, and even if you know that they just scared you, guess what? Your adrenal glands are already secreting cortisol, so your heart's beating as it's supposed to when you're in a dangerous situation, whatever. So a person doesn't have to say boo, but you can have a stress level, even a subtle stress, and it's still triggering that adrenal gland that's secreting that cortisol. and making you feel uneasy and whatever and stressful.
Right.
You add onto that life's travails, all the problems of life, not being able to pay the rent and where's the food coming from. And you're really putting your body under severe trauma. And so that's why it's important to remember what Susan says, that it's okay not to feel okay. Life's going to knock you around.
Right.
And you have to recognize that you can deal with this, that stress and anxiety are normal, depression's normal, and don't expect to be 100% of your day not having some type of stress and anxiety, because if you are, you're a very unique person. So this, I just want to belabor that point for you to know it's okay right now not to be okay.
Right. And what I'd like to get across with this slide is integrating your mental health care with your primary health care. You need to have those conversations of courage with your primary health care
That's exactly
provider.
right.
When you're feeling the stress, when you're feeling the anxiety, you need to know what signs and symptoms you're experiencing and share those with your primary care physician, because they are there to take care of the whole person.
That's exactly, but a lot of people, Susan, don't think, and I didn't either. It's not that they're wrong. I didn't think that way either. But if they're feeling that way, they need to verbalize their emotional state to their primary care physician, who could direct them to the behavior specialist, say at New Horizons.
Exactly. New Horizons, or one of the many other behavioral health professionals in town, because we're all about choice.
No, and we're all about, I'm just saying New Horizons because you're here, but any of the behavior organizations.
Right. And sometimes your primary care physician may be able to help you out too if it's something that's not rising to an extreme level. Your primary care physician may help you. So you need to fully integrate your mental health into your personal wellness by knowing the signs and symptoms of mental illness and reducing stigma around mental health and addictive disease. And one of the best ways you can reduce stigma is to have those conversations of courage, like we're doing right now, talking about mental health, letting people know that it's okay to not be okay. It's just not okay to stay that way.
And you want to know something, and we have come a long way now as a society, because I can remember when I was growing up, it was a huge stigma. I mean, if you were afraid to even say anything to anyone.
Exactly.
And so we have really become educated programs like this one here, that's letting people know that that you can have a mental problem. And you want to know something, a lot of the mental problems that that you undergo may not be as significant as you think they may be.
Right.
As you as a person may think. And so this is good.
Well, part of it too is a lot of celebrities are opening up about their battles with mental illness or addictive diseases. And you've got Justin Bieber has a big song out right now about his struggles with loneliness, mental health, and addiction.
I didn't know that.
Oh yeah, it's a big hit right now. I'm so lonely. And he talks about what he was going through with his battles with addiction and loneliness.
And he's a star that has
worldwide
arenas full
of
isn't
fans.
That something?
And somebody who you think would have everything going for them. So it's important to know the signs and symptoms of anxiety, depression, suicide, and substance abuse. If you could go to the next slide, please. And this is what we were talking about earlier. Anxiety is a normal response to a stressful situation.
Yes.
But when the stress is prolonged, like what we're dealing with the COVID pandemic, anxiety may rise to a level beyond our coping skills and require medical intervention. And most people feel sad or depressed at times. Again, it's a normal reaction to loss or life struggles. But when intense sadness, including feelings of helplessness, hopelessness, or worthlessness, lasts for many days or weeks, it may be something more than sadness. It may be clinical depression.
Right, and this is for individuals who are not trained like you and I'd just like for you to just go back to that so that they will know. See, with anything, you have to be able to recognize the signs, because the Bible says my people perish for lack of knowledge. So would you repeat that? It is normal.
Right.
It is normal.
It is normal.
But repeat what you just got finished saying, that if it lasts
for a prolonged period of time, days, weeks of feelings of helplessness, hopelessness, worthless, worthlessness, sadness. That could be clinical depression.
right.
Anxiety, weeks of feeling on edge, not knowing what's going on.
Lack of control.
Right, that could be a level of clinical anxiety. And both of these are medical conditions that can be treated.
Sure.
That's what I want
We're
people
getting some really good information here from us. And you want to know something? And it is necessary because the focus of this show is focused on health, which is physical health and mental health, which are integrated. And I would like for you to start thinking about that integration, thinking about that when you're talking about health, you're talking about mental health and physical health here.
Right.
And so, Susan, we're going through these slides really good, and you're giving a lot of good information.
Thank you. And again, there is no health without mental health.
There is no, and we're going to repeat a couple of things. Your prime thing that I'm taking over. I am taking over some of her expressions, by the way. It's okay not to feel okay.
Yes.
That's a biggie with me right now
it's
when she
okay
mentioned
not
that. And then there is no health without what?
Mental health.
There is no health without mental health.
So some of the signs and symptoms of anxiety and depression in adults overlap, and there's an area where the signs and symptoms can be common, and those include sleep disturbance. For example, with depression, you may find yourself sleeping a lot longer than possible, or you may have 8 hours sleep at night and still feel tired during the day.
Right.
With anxiety, you may not be able to get to sleep. You may find your mind is racing and you have all kinds of thoughts that are keeping you from falling asleep.
Right.
So a sleep disturbance is a sign or symptom of anxiety or depression. Poor concentration, you're not able to focus on the tasks at hand. You're cooking dinner and you're forgetting what the next ingredient is in a recipe that you've done for your whole life.
Right.
So not able to concentrate. Increased fatigue. These are the common signs and symptoms of anxiety and depression. Psychomotor agitation. You could find that you're moving your hand or bouncing
shaking
your
your
feet.
leg.
Yeah, that you psychomotor agitation. Or you could have what they call psychomotor retardation, where you're more lethargic and your responses are not as quick
slow.
as
Yeah,
right, exactly. As you mentioned earlier with cortisol, those stress hormones are released, and those have an effect on our physical health as well as our mental health.
Right.
You could have muscle tension. You could find yourself grinding your teeth when you're sleeping at night,
Right.
or you're hunching up your shoulders and just carrying that stress around
That
with
load,
you.
yeah, that
right,
pressure.
right.
And now you're going to an area that when we did our Facebook Live show, when you talk about the children, because this is something that completely a person doesn't think about normally. All of us do this here. But I want you to talk about and stress, just us stop for a moment before we go to break, and just talk about children, how we need to try to recognize, because as you so rightly said on the Facebook Live show, children don't know how to verbalize
Right.
how they feel. Just like a lot of us as adults, we don't know why we're feeling, but we have
Right.
more of a vocabulary
Right, an
that we can
emotional
try to
vocabulary.
express to someone.
Exactly.
But children do not. And when
No,
you
they
talked
don't.
about this on the Facebook Live show, you hit a button with a lot of people. I've had a lot of
Yeah.
people call me on
Oh,
this.
very
here.
good, very
And
good.
so would you just take a moment
Sure.
and just speak about that?
Okay, and you can go to the next slide if you'd like to. So common responses to trauma in children. When people think of trauma, they often focus on physical injuries. However, people also can experience psychological trauma after witnessing or experiencing distressing events.
Right.
Trauma can be caused by natural disasters, including pandemics. I don't think people are looking at this pandemic as a natural
I
disaster.
know they're not, but it
that's
is.
what it is.
That's what it is.
And reactions to trauma can be immediate or delayed. So you may have the trauma now and not have a response for 3-6 months after the event
Sure.
actually occurred. And responses may differ in severity and can include a wide range of responses. Depending on the age of the child, your younger children, up to about 3-4 years old, may cling to their parents or caregivers. They can cry and be excessively tearful. They could be having more tantrums and be irritable, angry, and disruptive. And remember, these are children that don't know how to express, I'm feeling sad, I'm
Right.
feeling scared,
Right.
I'm feeling nervous. They don't have those words
Sure.
to let you know
They
what's
can't
going on.
verbalize it, yeah.
Exactly. You can see children regress in behavior. For example, older children, 6, 7, may start wetting the bed again. They may start thumb sucking.
Right.
Behaviors that they didn't used to, that they've outgrown, they revert back to. They may complain of physical problems such as stomach aches or headaches, and that's their way to express that they're going through something emotionally.
Right.
But you want to rule out anything physical, so you take them to the pediatrician and make sure there's nothing physical going on.
Sure.
The children may have nightmares, refuse to go to bed, or experience other sleep problems. Older children, like our teens and tweens, may be unable to concentrate on their schoolwork. They may develop unfounded fears.
Sure.
And they may lose interest in fun activities. They may isolate themselves a lot more often, be wrapped up in what's going on in their room or social media and not engaging with the family as
Right.
they used to. So it's important for us as parents and caregivers to know the signs and symptoms of when our children are experiencing
Right.
trauma-induced anxiety and stress. Yeah.
And what we're going to do right now, Susan, we're going to take a break, and we're going to come right back on the other end of this commercial.
Man, I wish the city would fix these darn potholes. Someone needs to report this.
Has this ever happened to you and you didn't know who to call? It's simple. Dial 311 or 706-653-4000. Columbus 311 Citizen Service Center. Our goal is to provide complete, accurate, and timely information to citizens and employees regarding complaints, inquiries, and requests for information. Columbus 311 Citizen Service Center, your direct link to city service.
Welcome back to Focus on Health. What Susan was talking about children is very important. I mean, she has covered so many issues that that really caught my attention, and I know it's really beneficial to you as well, and I do really appreciate Susan. Susan, would you look in that camera, because I do want individuals to know who you are, where you're coming from, and when they can come for help.
Right.
If they ever need it now.
Right. Susan Gallagher with New Horizons Behavioral Health. We are the public, not-for-profit community service board serving 8 counties in West Central Georgia. Our appointment line number is 706-596-5500. We are offering telehealth and telemedicine during the COVID pandemic.
Oh, I
right
didn't
now.
know that.
Yes, we are. So if you're worried about making an appointment, call us 706-596-5500 and let them know you want to know about our telehealth and telemedicine options.
Now, I don't want to put you on the spot, but can you let them know what counties you cover? Do you have that?
Sure.
So that individual will know.
Right.
Because I'm going to tell you something, Susan. In the counties, they have hardly any resources at all. And
Right.
so if you can just let them, because a lot of people may not know,
Right.
let them know what counties you cover.
We currently provide services in Harris, Muskogee, Talbot, Chattahoochee, Clay, Quitman, Randolph, Stewart, and did I miss? No, that's it. That's it.
That's
8
it.
counties.
That was 8 counties.
Harris,
Alrighty.
Talbot, Muskogee, Chattahoochee, Quitman, Clay, Randolph, and Stewart counties.
There we go.
There, 8. I had to count them on
I
my
didn't,
fingers
I didn't,
that
I didn't
time.
want to put you on the spot, so I'm glad that you know that. Okay, I guess we can go on.
Okay, great. So yes, that emotional literacy is important in children, and as parents and
That's
caregivers.
a good term, emotional literacy. That's
Right.
because they don't know how to verbalize.
Right, they don't have that vocabulary, and we need to watch for those signs and symptoms, especially in our young children who don't have the vocabulary at all to experience.
Sure. But they
explain what
just,
they're going
and you need
through.
to let the parents know, maybe that's why they're acting out.
Right. And we need to be supportive. You know, they say it takes a village. If you see a child at the store that's acting out, or, you know, be supportive of that parent and realize that this
Right.
child may be experiencing a little
That is
stress
exactly
from
right.
what's going on with the COVID
Now,
pandemic.
don't always
too.
condemn the parents. Why can't you keep the child quiet?
Exactly.
Yeah.
Exactly. Put yourself in somebody else's
Else's shoes.
Yes, exactly. So if you could go to the next slide, please. what we want to do is have conversations of courage around our mental health. Reduce stigma around mental health and addictive diseases by let's talk about mental health.
Right.
Having these conversations of courage brings the problem out into the open, and you may find somebody that can help you. We talked about this on Facebook Live. It's a conversation is a two-way street.
Right.
Not only do you need to check in with folks and let them know how you're doing, you need to ask them how they're doing.
Exactly right.
And listen to that response
Sure.
too. We really need to work together during this time and be kind and understanding while we're all going through this stress, anxiety,
Sure.
uncertainty of what's going on. You need to have the conversation around mental health, normalize the conversation, and welcome the conversation. And one of the best people to talk to when you're having problems with your mental health is your primary care physician. Do not be afraid to make a list of things that you're experiencing.
Right.
Maybe you're having that disruptive sleep. Maybe you're grinding your teeth at night. Write these things down, and
So
when
that
you
we
so
can
you
express
don't
them.
forget when you go to the doctor, you can tell him what you're going
You
through.
use an expression, normalize the conversation.
Right, right. Normalize the if you're talking about it in a normal, you and I are probably from a similar generation. Do you remember back in the 50s and 60s, if somebody had cancer, they wouldn't say it.
Oh my goodness, they
would
wouldn't say it. No,
they'd
no, are
say
you
the
kidding?
C word, or
Yeah,
they'd
that's
whisper it.
exactly right.
Nowadays, people are talking about when they're ringing the bell and finishing their treatment. They've normalized the
And that's what I wanted you
conversations.
to emphasize. And Susan, you are just so good when it comes to expressing things. But no, that is normalizing, because back in the day, oh, that person's got cancer.
Yes.
They would whisper the word.
Right,
But now
right.
it is normalized, and people
Exactly.
are celebrating
Exactly.
it. And so we need to normalize the conversations about a myriad number of emotional issues.
Right.
I had a conversation with someone, and they were telling the person's bipolar.
Yeah.
You know,
Yeah.
that's another thing that, they need to say bipolar. That's
Right.
no, you know, they need
Normalize
to.
it,
It's
right.
normalize
Right.
it and let people know about it.
Right.
And I always try to tell people, just as a person, maybe diabetic. What mental illness is an imbalance in the neurotransmitters
Right,
in the brain. It's a
exactly.
Someone told me, let me see if I can get it together now. When you're talking about mental illness, it is the expression of a physical imbalance in the brain.
Exactly.
That's what it is. And it's just the way the person acts. It's just the expression of a physical element. Just like a person who's diabetic might be hyperglycemic or hypoglycemic.
Right, exactly.
And people need to know it's nothing to be ashamed about.
Right. The brain is the most stigmatized organ in the human body.
But see, I can't write down, I can't write down all these expressions that I really want to just keep, you understand, because she just comes off the top of her head. Say that again, please.
The brain is the most stigmatized organ in the human
That's
body.
unbelievable. I'm going to have to try to memorize that so I can write it down later. Susan,
Well,
that's
think
really.
about
but
it.
But you want to know something? You're right.
Traumatic brain injury, chemical imbalances in the brain. We don't talk about those as we do other organs in
That's
the body.
exactly right.
We look at it as a character flaw or defect, where if somebody has heart disease or diabetes, you're not going to think of it as a character flaw.
No,
It's
you're
a
not.
problem with an organ in their body.
And the brain is an organ.
Exactly.
And the brain is an organ.
Exactly.
A lot of good stuff here Susan's talking about.
All
Here's
right.
my favorite I say not favorite right
Favorite
expression.
right. It's okay to not be okay all the time. If you go to the next slide, though, because we need to know when to seek professional help. It's not okay. It's okay to not be okay, but it's not okay to stay that way.
There you
There's
go.
help, there's resources, your primary care physician, New Horizons Behavioral Health, you can turn to us. When you don't want to go for weeks and months feeling okay, not okay, there's no reason to put yourself through that. There's
That's
help
exactly
that's
right.
available. You can go to the next slide. Okay, great. This slide is perfect. So there are plenty of state, local, and national resources to help out. If you need help with housing, food, childcare, contact the local United Way at the 211 number. They can connect you to all kinds of local community resources.
And isn't that 24/7?
24/7, yes, sir. And I believe it's 365 days a year.
That's awesome.
The 211.
So people can always reach out to someone to normalize the conversation.
Exactly. And the United Way also has a wealth of information on their website, and they even have listings for mental health services
Wow.
out there. DBHDD, the Department of Behavioral Health and Developmental Disabilities, who New Horizons works under, has established a COVID pandemic emotional support line. Maybe you're home alone, don't have family, friends to talk to. You can call the emotional support line.
I'd like for you to do that again, because there is a segment of the population that I deal with, that seniors whose children have moved away. And you know how we parents are. You're a parent. You don't always want to, especially if your children are away from you, to quote unquote burden them, not
Right.
knowing that the children don't consider it a burden.
Right.
So a lot of the seniors who may not be as mobile, may not have transportation, or transportation may be an obstacle for them. This would be very important. And so now, could you verbalize to our audience what it's called?
Sure.
And the number? Do you have the number?
I have the number,
Could
yes,
you
sir.
do that, Susan, please?
Sure. This is the COVID-19 emotional support line. And it's what it says. If you're feeling a little down, if you just need somebody to talk to, the phone is manned by volunteers who are trained in mental health first aid. So if you call them and they sense that there's something a little bit more than just this person just needs somebody to talk to, they will connect you with the crisis line. But the emotional support line is there. That number is 866-399-8938. That's available Monday through Friday, 8 a.m. to 5 p.m. You just want a friendly voice on the other side of the phone?
That's what I'm saying.
Call this number, and there's somebody there to talk to.
Give it that number again, please.
866-399-8938.
And is that on the screen here? Is that
Yes,
number?
it is. It's that very first one on the upper left corner of the screen.
Okay, good. Thank you, Susan. Thank you so much, because this is definitely a blessing for a lot of people
Right.
to really know. And I do encounter individuals that when they see me and I talk with them, and we are social distancing, because I believe in being on this side of the earth a little while longer, but I could be standing outside their door and they just want to talk. And I know that if I stand there long enough, they're going to eventually open up. And so I see that a lot. And so the bottom line is, this has just been a blessing, all the information
Yeah.
that you're giving out now.
Now, if somebody is having a mental health crisis, the Georgia Crisis and Access Line is available 24 hours a day, 7 days a week, 365 days a year. They don't close for Christmas. They don't close for New Year's. And the Georgia Crisis and Access Line is staffed by mental health professionals. So if anybody is in a mental health crisis, they can call 800-715-4225, and there'll be somebody there that can get them the help they need right away.
Good. This is awesome. Susan, you're giving a lot of information. Then the last slide is New Horizons.
New Horizons, exactly. We are serving as your safety net provider of core behavioral health services to children, teens, adults, and families in Muskogee County and the 7 counties surrounding in the Chattahoochee Valley. And our appointment line number is 706-596-5500, and you can ask about telehealth or telemedicine. We'd be glad to meet your mental health needs during the COVID pandemic and beyond.
You know, Susan Gallagher is one of my favorite guests, because she just can talk off the top of her head on a lot of issues. And so, Susan, I just want to say thank you.
Oh, thank you for having me.
Thank you for coming here. I also, as I always say, I'm thankful to this Columbus Consolidated Government, Mr. Mike King, the producer, and Bruce. Bruce says he could hear my phone ringing, so I apologize for the ring. I think he might be able to mute that down, but this is Bruce. Bruce is in the control room. Bruce, Mike King, Of course, the mayor, Skip Mendelson, the city manager, Isaiah Hughley, for allowing this program here, for me to bring this program into your homes, because the goal of this program is to educate you on a lot of health matters and behavior matters. And I always close out by saying, until next time, please be good and kind to yourself, because God loves you. Bye-bye now.